think that it's been a lot of advances that is pretty exciting, not just for clinical management, but the updates on the research on new therapeutics. Um, there was this excitement about gene therapy, and that plenary sessions on gene therapy for Duchenne's, I think it's very informative. And that really leads us clinicians to anticipate what's coming for the next few years with regards to trials that we are engaging in, and also, if successful, the treatment that is really a milestone for this community. And also with the posters, one's able to get a good idea about the state of the diagnosis for Duchenne's, in terms of, are we better off in delaying that odyssey of getting a diagnosis? And basically, there's been great updates from big groups like the MD StarNet and the colleagues in London's North Star Registry on the outcomes of clinical outcomes of patients on steroids in the younger age group of 4 to 7s, and also our older patients who are non-ambulatory. So that gives us pretty much up-to-date information on how to make decisions with regards to the standard of care steroid therapy, which I'm aware there's still a lot of concerns, and what I call steroid phobia that is limiting providers and families from committing to an effective therapy because of the side effects. And on the other front, we also see an update from the posters on the various newer therapeutics that have emerged. The RNA-based therapies like the antisense oligos for mutation-specific skipping, for skipping 51, 53, 45, and updates from our European colleagues for atolurin in the nonsense-mediated mutations type of patients. So one gets a really balanced update, I think, on what's happening with the newer therapeutics. And on the other hand, for those of us who are clinicians involved in clinical trials, you do get a good update on the outcome measures that we have been working hard to refine in terms of North Star and a non-invasive biomarker like MR imaging. So the posters really at WMS have always been helpful for us clinicians to really map our clinical practice, and also clinical trials, what to come and what to expect for the side effects of these newer therapeutics, as well as in clinical trials. So I found it meeting our needs as providers for patients with Duchenne muscular dystrophy. That's a lot. I mean, just one disease itself is enough to take up those hours. So it's a great meeting. I see it's a great successful meeting.